name is Wangoi Mathenge. I'm a pharmacist by profession, but I'm also a consultant for pharmacovigilance and pharmacoepidemiology. We recently founded an organization called PVCC, Pharmacovigilance Competency Center, where we basically offer consultancy services to the health sector across Africa on various matters that pertain to patient safety affairs, especially with regards to pharmacovigilance. So with that, we want to welcome you to our channel. This is one of the platforms that we're going to be using to also communicate with you, in addition to our LinkedIn page, Facebook page, as well as our Twitter handle, which is now at PVCC Consulting. Just as a reminder, what is an adverse event? So we said an adverse event is any undesirable or unexpected symptom or response that occurs after taking a medicinal product, however insignificant it may appear to be, and whether or not it appears to have been caused by a medicinal product. So in short, what we are saying is, if you happen to be on any medication, whether long-term or short-term, and you end up getting any event that you feel was not expected, we ask you to open that platform and get in touch with your healthcare provider. That could be your nurse, it could be your doctor, medical doctor, it could be a clinical officer, it could be anyone that you're working with in the particular health facility that you have visited. So get to engage with them, talk to your pharmacist as well, and when your healthcare providers take up your case, they usually forward it to the pharmacist, who now is able to process them and forwards them to the health authorities for further action pertaining how your case should be handled. So what we are saying is, please, when you come across anything that you feel you're not happy with after taking a medicinal product, engage your HCP, engage your healthcare provider. And so with that, what are these notable events that we're talking about? Notable adverse event, what are they? And how would you say that this particular thing or this particular event is an adverse event, and this is something else that is not an adverse event? So there are a lot of things that may happen, and this particular clip is just supposed to help you, not really narrow down, but to help you consolidate what would call an adverse event, a notable adverse event. So to begin with, we are starting with just listing down some of the common examples of adverse events. And first, we do report side effects. We also report allergic reactions. We also report cases of drug abuse and drug misuse. We also report overdose of any medication, whether it was intentional or it was accidental. We also report medicines that lack efficacy. This is where now you get to hear patients complaining that this medicine did not work as they have been used to or they expected. We also have occupational exposure. This is mainly now for the healthcare providers, especially in the area where they're manufacturing or they're reconstituting this medicinal product. And for some reason, maybe they either got exposed, whether topically, when they were reconstituting, or maybe they injected themselves when they were trying to, prepare your medicine for injection. Off-label use, whereby your healthcare provider may end up prescribing a medicine that is not particularly indicated for that indication that you're suffering from. We also recommend for that to be recorded by your HCP. Medication errors is also another event that should be reported, and again, this may come as a shock. It's not really a side effect. It's not really an adverse event, but these are occurrences where we say these are vulnerable patients, and we usually like to take care of them in recording of the AEs, and this is now in breastfeeding and in pregnancy cases. So when you come across any of these 11 notable events, or anything that comes close to this definition, we ask you, please engage your healthcare provider. And this could be, again, your medical doctor, it could be your nurse, it could be your pharmacist, it could be anyone that you're visiting at the hospital level. please talk to them, engage them, and we should be able to get a solution for you.